glasses, you may need to get glasses at this point.
And hormone replacement therapy, do you think that's good or bad for this?
There's no evidence that hormone replacement therapy helps dry eye.
Right. And it may be bad for a number of things.
Yeah, it may have other side effects systemically in other parts of your body. So we usually treat it topically with artificial tears eye drops and occasionally prescription eye drops.
And for someone with new onset dry eye in their 50s, what's your approach to them?
My approach is typically to start on over-the-counter lubricant drops, taken 3 or 4 times a day, and then see how their dryness is with that. If that doesn't work, or if the patient's not compliant or can't find the time to do that several times a day, then I will go to one of the prescription medications such as Restasis or Cequa or Xiidra, which are very helpful in about 75-80% of patients. Rarely, some patients have severe dry eye, and then we need to do other things like pump their drugs and other types of medications.
So we have a lot of treatments.
Yes, we do, and they're very effective, but they have to be customized individually for every patient. Everybody's dryness is different.
All right, so thank you for your call, and we wish you all the best. Our next caller is Bruce from New York. How can we help you today?
Thank you for taking my call, doctors. A while ago, I was diagnosed with a chalazion cyst on my left eyelid, and the ophthalmologist referred me to an oculoplastic surgeon. I guess I'm saying it right. And he took it off, but he asked me. He seemed to know that I had sleep apnea. I'm just wondering what the connection between sleep apnea and the chalazion cyst is.
You get baggy words.
So first, explain what a chalazion is. All right, too.
Yeah, chalazion is basically a cyst that develops in the eyelid. It can happen in the upper or lower eyelid. It's an area of inflammation or swelling in one of the glands of the eyelids. The eyelids contain numerous little glands, and occasionally they become clogged up, inflamed, and swollen. And that can cause discomfort. It can also be not attractive to have a bump on your eyelid. The usual treatment for that is conservative treatment, such as warm compresses, occasionally some topical medications, anti-inflammatory ointments will be helpful. But there are underlying conditions such as blepharitis, which is an inflammation of the eyelids, which may lead to recurrent chalazions. So we want to make sure you don't have any underlying conditions. Otherwise, you'll get repeated chalazions and you can have surgery all the time, which you want to avoid if possible. To my knowledge, there is no connection with sleep apnea and chalazion development that I'm aware of. So
But some people have said on the show that people wearing masks are having more blepharitis and chalazions. And do you think the mask that are you wearing a mask at bedtime, a CPAP thing? Because I wonder if that's any factor.
I am not.
Okay,
no, I'm sorry, I'm not. I'm kind of resistant to that.
And you asked about the lids in sleep apnea. Oftentimes they have floppy lids, where they'll turn inside out and they'll get irritated eyes, and the eyelids are very lax. But I don't per se think that's related to chalazions, which I think is related to eyelid inflammation with meibomian gland disease, which is super common in fair-skinned people.
Right.
But I think most people who've gotten chalazions, it's a good idea for them to use a warm compress once or twice a day just to keep their eyelids clean, to try to not get more of them. And you also, if you get recurrent chalazion, can be put on oral doxycycline to try to prevent them, but then that you have to be careful about sun exposure and may have an upset stomach, so we rather deal with it topically and locally. But warm compresses can make a big difference if you're faithful with them. Thank you for your call, and we wish you all the best. I'm Dr. Elizabeth Cohen, along with my co-host, Dr. Salem Scaletta. You're listening to The Brain and Eye Show on Dr. Radio, Sirius XM. Today, we're taking any of your questions about your eye. Please give us a call at 877-NYU-DOCS. That's 877-698-3627. And there is Carolina.
breath generation and have been getting injections for about 11 years. I'm currently getting Ilea as my injection. The injections don't bother me that much. People cringe when I say I get eye injections. But the wash, the aide first, numbs my eye, and then she washes my eye with betadine. And I'm allergic to iodine, and it sets me on fire. And I just wondered if there was any other, and my doctor doesn't do washes afterwards because of possible infection. Is there any other disinfectant that could be used?
Good question.
Yeah, that's a question that occasionally comes up even when we do surgery in the operating room, such as cataract surgery. There aren't too many alternatives to the betadine, which is very effective in eliminating bacteria and avoiding infection.